Okay, go.
Alright, so I'm checking my marks and that my patient will be receiving an NG tube to help with some stomach issues that they're having. And then I'm going to gather all of my equipment. I'm going to enter the patient's room. Good morning, Mr. Jones. My name is Tiffany. I'm going to be your nurse today. Can I get you to verify your name and date of birth for me? Alright, wonderful. Now, do you have any known allergies? No? Alright, great. So what's going to happen today is the doctor has ordered an NG tube for you to help out with the stomach issues that you've been having. I'm going to get that inserted today to help out with that, okay? Great. So it seems like you're already in high Fowler's position. So I'm going to go ahead and perform hand hygiene and put on my gloves. My gloves. I'm going to go ahead and put this towel over your chest here. Alright, and if I could get you to close one nostril and breathe out, and then the other. Alright, which one do you breathe out the best? The right side, perfect. That's the one we're going to use for our procedure today. So what I'm going to do is I'm going to go ahead and grab my tubing. I'm going to go ahead and place that on your chest here, and then I'm going to just measure. Nose, ear to xiphoid process. Looks like it's about 50 milliliters. I'll go ahead and tag that. I'll go ahead and get my jelly here, and I'm going to lubricate about 4 inches of my tubing and start to insert. So I'm going to have you lean back here and slowly insert the tubing into the nostril. If I get a little resistance, I'll pull back and start again. Alright, once I get in a little ways, I'm going to check your oral cavity here. I see no coiling at the back of the throat. I'm going to go ahead and have you take a sip of water. As you take a sip, I'm going to insert a little more.
There is a nice video for the NG tube if you all wanted to look at it.
Okay. Once I get to my mark, I'm going to take this here for a little bit while I verify placement of the tube. Alright. I'm going to grab my brush here. Okay, go ahead and just speak for me a little bit. Alright, great. I'm going to put on my stethoscope. I'm going to aspirate 30 ml. Alright, I see greenish yellowish stomach content. And as I put those back in, I'm going to listen for gurgling sound. Alright, I hear gurgling sounds, so I'm going to verify placement there. I'm going to go ahead and permanently, or not permanently, I'm going to go ahead and attach this to the nostril here for proper placement. And I would get my safety pin and my rubber band, and I would attach that to the gown. And turn your head a little bit for me here, so make sure you have a good length there. Good. And then I would attach this to my low suctioning device. And I would go ahead and clean up. And I would lower your bed back to the lowest position. I would give you your personal belongings. Do you have to use the bathroom at all? No? Are you in any pain? Alright, great. I go ahead and take off my glove, perform hand hygiene. Then I would go document the tubing, the suctioning, the gastric contents that I saw. And then I would come back some time later. Hi, Mr. Jones, how are you feeling? Can I get you to verify your name and date of birth again? All right, great. So we're just going to make sure that your tubing is still working properly here. Again, I would raise the bed to high Fowler's position. I would perform hand hygiene, and I would put on my gloves. And then I am going to get my towel, lay it back across your chest here, checking the position of the tubing before. Then I'm going to grab another pump here, remove it from the suctioning device, and draw up some gastric contents again, 30 mils. I see greenish yellow stomach contents as well. I'm going to go ahead and listen while I insert those back in for gurgling sounds. I hear gurgling sounds, so I've verified the placement of the tubing. I'm going to go ahead and discard this tubing, and I would grab another one, and I would draw up 30 mils of sterile water, and I would go ahead and attach it back to flush out my line and make sure it's open and patent. And then I'm going to draw up, see how much is in your stomach. I get about 35 mils of saline mixed with a little bit of stomach acid and gastric juices. I'm going to go ahead and unhook that, discard of those, and apply this back to the low suctioning device. I'm going to go ahead and clean you up here again. All right, clean up my area. Are you in any pain, Mr. Jones? No? Great. Go ahead and lower your bed back to its lowest position. Give you back your personal belongings. Do you have to use the bathroom at all? No? All right, wonderful. Once the patient is lowered back in position, I would go ahead and document again the gastric contents, the amount of saline or sterile water that I put in, the difference between what I took out, the suctioning, the size of the tube, and how well the patient tolerated the procedure. And that will be all.